Good afternoon. Joined by Dr. Mark Veach and Catherine Morgan-Wicks today. A quick update just in terms of numbers. COVID case numbers today are 842, while there have been 699 people recovered. This brings our total number of active cases to 4,080 and the total number of recoveries to 36,969, just shy of 37,000 people. There are currently 10 people in hospital with COVID and 5 being treated specifically for COVID symptoms, and currently 2 people in the ICU. In our schools, we currently have 41 schools across the government, Catholic, independent and school sectors with outbreaks, which are being supported by public health. Now, and I think it's fair to say there has been a slight uptick in school cases. This was always expected as school return, and just as we've seen in other jurisdictions where schools started 2 weeks ahead of Tasmania, schools in terms of the cases over time will trend downwards, but there is a slight uptick at the moment. Importantly, school remains the best place for children to learn. The Omicron virus is far milder, and our key metric remains hospitalisation, which is steady and far lower than anticipated, and we've had no school-aged children that have been admitted to hospital right throughout the opening period. Our strong vaccination status continues to serve our state well, with over 96.5% of 12 years and older fully vaccinated, more than 61.3% of 5 to 11s having had at least one dose, and over 54.4% of those eligible now having had their booster. I might just point to this, and Kath might provide a bit more detail, but in terms of our 5 to 11s, 61.3% having had their first dose, which leads the country. In fact, we're around 10% stronger in terms of vaccination. But it is across the state a little patchy. 68% in the south, around 60% in the north, and only 50% in the northwest. And so, in terms of northwest, I'd encourage you, if you're a parent and you're considering vaccination, to book into one of our clinics or see your GP and get vaccinated. Now, in terms of some close contact changes which were announced nationally earlier this week, we know that being a close contact can at times be more disruptive than being a positive case, in that in terms of some of the isolation rules, you could end up being in isolation for longer than 7 days if somebody else in your family tested positive. So with the rolling 7 days, we're going to change that, and that will now reduce the chance that people quarantining as a close contact of a household case will have their quarantine extended because of another case in the household. So under these new changes, which will come into effect this Friday, the period of quarantine for a household contact will be 7 days starting from the date of diagnosis of the first household case, so that when the case leaves isolation, the household close contact can also leave quarantine. And this will apply even if there is another family member diagnosed within the household during the course of that week, provided the person that is isolating as a close contact has no symptoms and has returned a negative RAT test on day 1 and day 6. Now, close contacts that are quarantining in a different location to the case, obviously it's the 7 days quarantine from their last contact with the case. Now, we're aiming for this to be in place this week by 12:01 a.m. on Saturday morning, so Friday midnight, and we expect that will be in place by then. Now, in terms of border restrictions, we stepped our way cautiously and carefully through the pandemic, and will transition to living with COVID just as sensibly. Around the country there have been some changes to border restrictions, and we're going to bring ourselves into line as well. Now, in terms of our border reopening, we opened on the 15th of December to fully vaccinated travellers to enable them to travel to Tasmania without the requirement to quarantine on arrival. Public Health have continued to monitor the situation, enabling us to remove additional measures for our vaccinated travellers as we move forward, such as the need to test prior to and on arrival, as well as registering travel. Now, although most people have been enjoying the ability to freely travel into Tasmania, for the small number of unvaccinated travellers, approval to enter and quarantine measures have remained in place. Today I can confirm again that from 12:01 a.m. on Saturday, so midnight Friday night, there will no longer be any entry requirements for travellers to Tasmania regardless of vaccination status. This also means that displaying vaccination status to enter venues such as pubs, clubs and events in Tasmania will no longer be required from 12:01 a.m. on Saturday as well. However, vaccination remains mandatory for certain workplace settings as set out by either a public health direction or by the instrument that secretaries and departments have utilised after conducting their workplace risk analysis. Now, this change is being made as a further part of our transition to living with COVID-19 and recognises that we have a very high vaccination rate and that maintaining arrival conditions for unvaccinated travellers is now disproportionate to the risk. While we've been able to remove the majority of our border restrictions, the remaining one we still have in place relates to cruise ships. At this stage, and there's been some national discussion about this, but at this stage Tasmania will be maintaining its current position in relation to cruise ships in Tasmanian waters, apart from these smaller cruise ships which are up to 99 passengers. In fact, I think with crew total of 99 on them, but Dr. Veach can provide more detail if you want on that. But in terms of the larger cruise ships, we will continue to keep that under review, and it'll be assessed in coming months as we lead up to the spring cruise ship season. But there will be no immediate move, regardless of what other states do, in terms of cruise ships. Now, in regards to other restrictions, last week we announced removal of check-in TAS requirements at a wide range of locations. However, that still remains in place at a range of pubs, clubs, events and some other locations. That is still under review. There is no change to that, and we'll continue to review that requirement as well as other restrictions, including the wearing of masks over coming weeks as we move forward. I'd make this point very clearly that some of the states are moving this weekend or early next week in terms of mask requirements. They open their schools in the main around 2 weeks earlier than what we did, and so we need to move through this period. We've seen a slight uptick in terms of cases, and we want to, as we have done right through this, ensure that we take a sensible, responsible approach guided by public health. So could I just thank Tasmanians for their ongoing patience. I know, in fact, in terms of the masks, that most people do not like wearing them, although I'd be fair to say I have met a couple of people that really are quite enamoured by the mask wearing and do like it, which surprises me. But we'll continue to keep it under review and act on public health advice. But again, as I say, we are moving to our own timeline based on when our schools started, and we'll keep this under review. But I want to be clear, I'm not signalling today that masks will come off in 2 weeks' time. What I am signalling is that we will continue to keep this under review, and we'll have more to say in a couple of weeks' time, depending on where we go in terms of case numbers. Now, please remember that it's the small things that make the difference. Ensure that you have good hand hygiene, that you cover your coughs and sneezes. Importantly, follow the restrictions that are in place, and if you're not feeling well, get a test. Don't go to school, don't go to work, and certainly don't go to the pub or a party. I'll hand over to Dr. Veach.
Thank you, Premier, and good afternoon. I'll just make a few statements about trends in cases and some recent school-related outbreaks that I expect will be of interest. Now, our case numbers had been going well, with a stable number of cases, around 550 cases a day through most of February. But what we have seen in the last couple of days is an increase in our case numbers, with more than 800 cases a day on each of the last 2 days, which actually pushes us to one of the higher rates of COVID transmission in the country. This is largely attributable to an increase in school-aged children, in cases amongst school-aged children, and in fact, if we look at the data yesterday, just under half of all the cases were aged less than 20 years. But in particular, the highest rates were amongst primary school-aged children, The next highest rate of disease was among secondary school children, and by contrast, the per capita or age-related rate amongst 20 to 50-year-olds has been pretty stable. And it's good to see that the actual rate of disease amongst people aged over 50 has been declining through that time. So I think the message there is, as the Premier mentioned, we are seeing an expected increase in case numbers related to return to school. We don't know precisely how long this increase in cases will last. The Premier signalled that we'll review some of our public health and social measures in a couple of weeks, and I think that's a useful sort of time frame to keep in mind. Even though the case changes we saw over the last couple of days has been quite quick, it's likely that school has to be back for a week or two before you start to see an increase in cases connected to that setting. So it's my expectation that we'll probably see this increase in cases play out over the next two to 4 weeks or so. I'll mention briefly the number of cases in hospital. There are 10 people currently in hospital in Tasmania with COVID, 5 of them being treated for COVID. 1 of them is aged less than 5 years, 1 of them is aged in their 30s, and the remaining 8 are all in their 50s and older, 2 in their 50s, 1 in their 60s, 3 in their 70s, 1 in their 80s and 1 in their 90s. It's important to note that despite the increased number of cases connected with school outbreaks, there have been no hospitalisations of children related to school outbreaks since school resumed. We currently have 41 schools affected by outbreaks. 36 of those schools are primary schools, 5 are secondary schools. 5 of the 41 outbreaks are what we call school outbreaks, where there are outbreaks in 3 or more classes. The remaining 36 affected schools have got 1 or 2 classes or groups that are affected by an outbreak of 5 or more children. The outbreaks are in the north, northwest and south, 9 in the north, 20 in the northwest and 12 in the south, and 30 affecting public schools, 11 affecting private schools. And of these school associated outbreaks, there's a total of 335 children who are active cases and 26 adults who are active cases. So I'll be happy to take questions.
Outbreaks. Is there any reason that you're aware of why there are so many of those outbreaks in the northwest? Seems like disproportionately a lot for the different population areas.
It is proportionately more than we would expect. It's possible there's a small contribution from a slightly reduced vaccination uptake in children in the northwest. We know that around about 50% of children in the northwest at primary school age level have received at least their first dose of vaccine, whereas it's more like 60% in the rest of Tasmania. That may be part of the explanation. The other thing is when outbreaks start in a particular geographic area, they have an inclination to spread within that geographic area. You know, children at one school will mix with children at another school at out-of-school events, and it kind of reflects the fact that it's a community outbreak that's being seen manifest in schools.
With the uneven, the disparity between the outbreaks in primary schools compared to secondary schools, was that expected? It seems quite a gap.
It is quite a large gap. It could reflect the fact that the lower vaccination coverage, as I mentioned. There are additional measures in place in secondary schools. They're generally wearing masks, and that may be contributing to fewer cases in the secondary school setting. But again, it may also reflect the fact that primary school age children will tend to mix with other, I suppose secondary school age children mix with secondary school age children too. So I can't offer a particularly clear explanation. The other consideration is testing. One of the questions you always ask when you see an outbreak or an increase in cases, is that real or is it just due to increased testing? And one of the possibilities is it's that increased testing of rats by using rats with parents picking up mild illness. And we know the illness in those school children is generally mild.
an update on vaccination, but first I'd like to provide a clarification. On Saturday the 19th of February, a COVID media release was issued by Minister Rockcliffe to note the sad passing of a male in his 60s. And the Minister and I have since spoken with a close family member of the deceased, and we would like to correct the public record to note the following in relation to the gentleman's sad passing. The person deceased is a male in his 60s. He tested positive for COVID and subsequently developed pneumonia and died from COVID. He passed away in his own home with the support of his close family member, who is a registered nurse, and with assistance from his medical practitioner and care team. The previous release had stated that he was a palliating patient. This was incorrect. The deceased received palliative care in accordance with his care plan after contracting COVID. To be clear, his death has been counted as a death due to COVID and is listed as death number 24 on the public information tile. Now, this information is more than what we'd normally provide in relation to a deceased COVID patient. However, this has been approved by the family member to clarify the record. And I'm also clarifying this information, noting some of the online commentary that has been directed to this case, questioning why it was reported as a COVID death. It is a death due to COVID, and I extend my sincere condolences to the family and to the deceased friends of this deceased gentleman. So if I can move to vaccination. On vaccination, as of 21 February, more than 99% of Tasmanians over the age of 12 have had at least one dose of the vaccine, and 96.6% are fully vaccinated. And the booster rollout is continuing to track well, with 54.4% of people aged 16 years and over with a third dose. However, as we head into autumn and winter, we don't want to let Tasmania's great work on vaccination go to waste. We really do need to get our Tasmanian population boosted. As at today, 143,000 Tasmanians aged 16 years and over are eligible but have not yet had their booster dose. We have strong booster rates across the state, but as the Premier mentioned, the Northwest is lagging slightly behind the North and the South. In the South, we have 57.3% of people aged 16 plus that have had a booster. The North is in line with the state average at 54.3%, and the Northwest, where we have seen a rise in positive cases over the last few days, is currently at 47.7%. So I'd encourage all Tasmanians and people living in the Northwest in particular to please check when they had their second dose of the vaccine and to book in for a booster the minute that they're eligible, and that is some 3 months after your second dose. Data shows over time that protection against serious illness and hospitalisation given by 2 doses drops to around 50% after 4 months and 30% after 6 months. So getting your booster increases your protection against serious illness and hospitalisation and bringing it back up to around 90%. So please get boosted in a state clinic, at your GP or at your participating pharmacy. We have thousands of appointments available at state-run vaccination clinics in the next 7 days in Burnie, in Devonport, Huonville, Glenorchy, Launceston and Hobart. And this includes hundreds of booster appointments available at the PW1 Super Clinic on the Hobart's waterfront this Sunday. If I can talk about 5 to 11s, the rate of vaccination amongst children aged 5 to 11 continues to rise, with 61.4% having had a first dose, and this remains around 12 to 13% above the national average. However, there are still more than 17,000 children in this age bracket who haven't had a first dose of the vaccine. And as with boosters, the Northwest is lagging slightly behind, with 50.6% of children in this age group having had a first dose, compared to 60.7% in the North and 68.3% in the South. And with cases now in schools, I strongly encourage all parents to please bring their children forward for vaccination at the earliest opportunity. And this weekend we have specialist children vaccination clinics in Burnie, in Devonport, in Launceston, Hobart and Glenorchy, and walk-ins are welcome at all of those clinics. Next week also marks 8 weeks since the start of the children's rollout, which means that we'll be starting to give children their second doses. So I'd encourage all parents to please check and make sure that you have that second dose appointment booked in. And just to finish on Novavax, dozens of Tasmanian pharmacies and GPs now have stock of Novavax, and I'm informed that in Tasmania around 210 doses of Novavax have already been administered. So please, if you have been waiting for Novavax for that first dose of COVID-19 vaccine, please check the clinic finders, go and find a participating GP and pharmacy and get that first dose.
On I suppose, the different vaccination rates in the northwest, it is an area with a lot of remote communities. Does the health department have to do more to, I suppose, make it easier for people to actually access both the boosters and vaccination for their children? Does it mean, I suppose, offering more services outside of those main population centres in the northwest?
Absolutely, and that's why we have been partnering with, for example, the RFDS in having a regional roving vaccination bus to actually reach some of those more remote towns and communities. And we are at the moment doing final arrangements with the RFDS to actually visit district schools, particularly in the northwest where you're seeing that kind of K to 12 population, to try and hit an entire school at once. We're also looking across our school populations to work out whether vaccination clinics within a school but outside of school hours, so an after school appointment may work, and we're looking at the numbers of unvaccinated 5 to 11s in each of those school environments to work out where the best bang for our buck in terms of the clinics and how we can run them with schools, noting that parents have to provide consent obviously for the 5 to 11s and prefer to be most often with their children for that vaccination to occur.
Just a quick clarification on the gentleman's death at the weekend that you mentioned. You said he wasn't a palliating patient. So, just to clarify, does that mean that he was an otherwise healthy person who contracted COVID and obviously became seriously ill and chose to die at home? There was no issue of him, I suppose, not being able to get treatment at a hospital or anything like that?
No. So in terms of this gentleman, and we have reached out to the close relatives of this gentleman and certainly talked about his arrangements. So, and often when it is a patient in hospital, we have a different level of information that obviously we can check and provide. This was a death that did occur at home, and I mentioned that he had a care team that was involved and his close family member who was a registered nurse and medical practitioner involved. So that's personal details for that deceased gentleman, but we wanted to clarify the aspect of the palliating and that palliative care was provided after the deceased had contracted COVID.
His choice to pass in that way at home rather than in a hospital.
Yeah, as it is every Tasmanian's choice.
Questions for the Premier?
Thanks, Catherine.
Premier, I'm interested, why is the Check-in Tas app still under review, and are you still using it to contact trace at venues at the moment?
Well, in terms of the Check-in Tas app, that's currently in place at pubs, hotels, for larger events where potentially there is a higher risk. Now, if there were to be an outbreak, and we saw an outbreak at an event earlier this year, one of the festivals that was held up north, and so under those circumstances, yes, we will reach out. So it is important if people can continue to use that app, but as I said, these measures are continuously under review.
What would be your message for parents that's here today that there's 41 school outbreaks, 36 of those in primary schools? What would you say to them to encourage them to continue to send their children to school?
Well, again, and I'd make this point, and I think it's a really important distinction. The system is working because we're picking up positive cases in the kids and they're at home. They're not at school. And I think that's really important. And when I've said before, in terms of the term a school outbreak, that doesn't mean that COVID is rampant in the school. It means that we've had a certain number of cases across a number of classes, and those kids have tested positive and are being cared for at home. So my message to parents is that the best place for your child's well-being and learning is at school.
Just in relation to no longer requiring vaccination to go to places like a pub or a club, does that mean that the staff who work in those venues, who I believe were required to have vaccination, no longer have to either?
Well, that would be dependent upon their employer and whether or not they have a direction that they have lawfully put in place in terms of their staff. Obviously, for those facilities or for those types of venues, they were all captured under the public health direction. But in terms of that coming off, then in terms of employers, as we do in the public service, if there has been a risk analysis that has been conducted and the employer believes that it's the right thing to have their staff vaccinated, then that's a matter for the employer and individual venues.
The ABC has reported that in early 2020, the then Health Minister Sarah Courtney warned a nurse at the Launceston General Hospital not to air allegations against the James Jeffrey Griffin allegations publicly. Labor has suggested that indicates that the government was wanting to cover up the issue at that early stage. Is that true?
No, absolutely not. In fact, look, I'd say to those that continue to take shots in terms of these very difficult matters, this is the government that has put in place a commission of inquiry. And all of those matters are now able to be inquired into by the Commission of Inquiry, noting that Mr Griffin was not just a perpetrator under this government, but under previous governments as well.
Do you support Senator Claire Chandler's Safe Women's Sport bill, considering it could have implications for sport inclusion in Tasmania?
Well, look, I think we have an inclusive society, and I think the way that we manage sport in Tasmania is a reflection of that society. I don't believe that there's any need for this bill, but that's a matter for Claire and the Federal Parliament. But what I wouldn't want to see is any weakening whatsoever of our anti-discrimination legislation.
You foreshadowed some negotiations with the Tasmanian Aboriginal community, and there was a report last year. Can you bring us up to date with where that process is at, please?
Well, look, I've had a number of meetings over the Christmas period with members of the Tasmanian Aboriginal community. And as I indicated last year, when we return to Parliament this coming month of March, that I'll have more to say.
Were you able to pitch the idea of a covered stadium to Scott Morrison when you had a chat with him in Launceston the other day?
Well, look, it's interesting, and I do note the interest in that. I would point to the fact that in the 2019 Task Force report that has been on the public record now for nearly 2 years, that Brett Godfrey and his team actually highlighted that two things. One, that our current infrastructure in place, both at Blunston and at UTAS, is more than adequate in the short term, but that a covered stadium in Tasmania should be an aspiration. And obviously, my meeting with Alistair Clarkson, he indicated that he believed that that was important as well. And so with that, obviously, we're well aware of the Task Force's view, we're well aware of the AFL's view, and like with many things, I'll have more to say in the coming month.
Just quickly, the Australian Bureau of Statistics has released data on the annual, most recent annual wage rise. In Tasmania, it was 3.2% for the private sector and 2.6% for the public sector, but the consumer price index rose by 4.5%. Is your government doing enough to keep cost of living increases in hand, considering Tasmanians' wages are not increasing in line with them?
Well, obviously, look, we've seen an increase in CPI in recent quarters. But I would make this point, and I do note that Dr Doom was out today. We have led the country in terms of a wage price index increase. Now, I think it's important to recognise that both the public sector increase and the private sector increase were both above the national average, and in fact I believe that we were the leading state in terms of the wage price index across the country. And so our wage growth is stronger than other jurisdictions, and I think that's a point that should be noted.